Live. And I believe so. So welcome everybody, and welcome Dr. Scott Hoffinger to CastCoverz first Ask the Ortho. It is 12 o'clock on Wednesday, December 2nd. And I wanted to welcome everybody who's here. And I don't see the chat yet, but it's a new technology. We're checking it out. But I wanted to welcome Dr. Scott Hoffinger. And Dr. Scott Hoffinger is a certified board orthopedic surgeon, but he was the director of pediatrics for Stanford. You can correct me if I'm wrong, Scott. And also for Oakland Children's, as well as a number of other things. So Scott, you want to give us a little bit of background?
Hi, everybody. I'm a pediatric orthopedic surgeon, and from the East Coast, ended up on the West Coast, and I was at Oakland Children's Hospital for 20 some odd years as the chief there, and spent the last 7 or 8 years at Stanford, where wasn't the chief, but in charge of some things, but a great group of people. So I've been really fortunate to have a great career. And then last year I took a year off, went to get a master's degree in London. And now I'm back in the US while the world is shutting down. So
yes,
I'm back home here, and welcome.
And one thing I wanted to point out to everybody, that Scott told me that his biggest accomplishment, however, are his 4 children. Yes, which are all young adults now. And Dr. Hoffinger and I met through a colleague of mine who happened to see him, Tamara Monosoff, who happened to see him, and one thing led to another, and we've done a few things together. And then a couple years ago, you had an accident, and then you used our products as well.
Yep. If I had torn my Achilles, I got to tell you, I was ice climbing in Alaska, just so people know, I didn't just do it falling out of bed, and I had an Achilles tendon repair, and I'd been on crutches as a kid, but it's tougher as an adult. And so I thought, wait, we can use all these things. So I used the crutch covers, I used the cast cover, I used all
the
that
waterproof,
stuff, and I used it all. So it's like, I'm not just a fan of the product, I'm a customer. So I've used them.
Oh, great. Okay, that's great. And then, so I'd like to have the opportunity, I'm just checking, if you see me looking down, it's because I'm looking at our live feed on Facebook, and I'm looking for any comments. So one of the comments that we had that seems to be common, and of course, CastCoverz is a United States-based manufacturer. We are an orthopedic soft goods company. We make covers for cast, braces, splints, boots, crutch wear covers. You can see right over my shoulder right there. And USA-based manufacturer. I get to ask that a lot. And we've been in business over 11 years. And we're the one-stop orthopedic shop. And so we help our customers feel better so they heal better. And we know that it's really difficult. My own daughter has broken 22 bones. So I totally get it from the perspective as the caregiver. And there are many people that break bones are first time, only time, and they're done, one and done, and they're gone. Some people come back. I have found that we've got about a 13% return rate, where we have customers come back, about 13% come back. And so a couple of questions that keep coming up that are repetitive that we see, that we answer all the time, is, can I get my cast wet? So Dr. Hoffinger, can you elaborate on that and answer that question?
Sure. So humans are waterproof. Fiberglass is waterproof. Padding is usually not waterproof. So there is waterproof cast padding that exists. And if you have a waterproof cast and you're not after surgery, most of the time you can get it wet. It's just a simple question to ask your doctor, or the doctor or the cast tech will be telling you these things, and pay attention to it, because if it's not a cast with padding that's designed to get wet and you get it wet, it's nasty inside. It's nasty. It's kind of a green, kind of a mold, mildew get on your skin. Yeah. So
and it smells like that too.
It smells nasty, and it just, you got to go in and get it cut off, and so it's just not fun. And so, assuming that you don't have a waterproof cast, you need to be really careful. And even with the CastCoverz cover, be paranoid. Tape
Mhm.
it, cover it, watch it. So as an adult, if you take a shower and you have a cover on, you're going to be cautious. But if you're a kid, you don't care. It's like, cool, look how much water I got in this, mom. So expect everything. Parents, expect everything to go wrong. But
Yes.
try hard not to get it wet unless it's designed for that. And things like the CastCoverz are really good, but you still have to be smart and watch and make sure it doesn't get water inside it.
Some of our stories of our customers, we had a customer call and say, well, we've got a hole in it. And I said, well, how did that happen? And the mom said, well, little Bobby was running his hand along a chain link fence with it. Yes, the waterproof product will rip. That doesn't count as a defective product. She laughed. She thought, why am I calling you? I thought, I'm not sure. But the waterproof products, you're absolutely right. If, just be ultra careful. Children are different. They'll be even under the water. Let's say 9, 10-year-olds will be under the water and they have an arm cast or leg cast, and it has to be tight to seal around the skin above the cast. And so you can't, it's not intended to wear all day long. It's intended to wear for periods of time. And so kids, without even recognizing it, they'll just kind of like fumble with it underwater because it's tight, or on their leg. And then all of a sudden it fills with water and they don't know why. And so that's something else. So that was very good advice. Dr. Hoffinger does say, with kids, you have to be really, really careful. Adults, it's very different. We can really kind of tell them, these are some of the, aspects that you have to consider when you're wearing one of the products. So anything else about that?
Nope. I think you got it all.
Okay, great. And then a couple other questions that have come in. Let's see, we've got, a couple of the other questions are, so why is it when, and we get this quite a bit too, you have a little tiny one, like under 3 or under 2, that gets a cast, particularly leg, and you walk in the room and little Jane is over on one side and the cast is on the other side?
Yeah. So slipping out of casts, we always say that if you haven't had a cast slip off, you haven't put on enough casts on kids. So there's a couple reasons for that. And one of them is that you don't want to make the cast too tight. Make the cast too tight, it won't slip off, but it can be very uncomfortable. And especially if you're going to swell inside the cast, you have to take that into consideration. The next is that kids are just wiggly. They'll spend all night trying to wiggle themselves out of it for some reason. It's that kid thing in their head. And so if it happens repeatedly, sometimes kids that have that are kind of chubby, that's a little harder to keep some casts on. And so it's a balance between how tight to make the cast and how to allow them to have room to be comfortable in the cast. And so depending on what happens, if the cast slips off, let's say you're getting a club foot and a baby casted, cast slips off, call up, come back in and get another cast put on. Mm-hmm. If it's a fracture, then if it's the weekend or an off hour time or holiday, you may need to go to the ER and have a splint placed. But sometimes it'll happen later on in the process and the fracture is fairly well healed. And then again, you can give a call and they'll bring you in the next appointment. And another point to bring up on this is the cast slipping off is a bit of an issue, but worse than that is when it slips partway off. And if it slips partway off, then the cast angle is pressing on a different position. And you'll know because they're very uncomfortable. So slipping off, not great. Slipping partway off, worse, because it catches the foot or the ankle or the wrist, and it can be really uncomfortable. So just be aware also if you see the toes disappear inside the cast or the hand and all of a sudden, where'd the fingertips go? It's because it's starting to slip off.
Oh, excellent points. Very good points. So what I do hear you saying though is don't panic if you find the cast in one side of the room, or just to call the doctor and try to get in. Okay, that's great. So another question we had is, why do casts smell? You might have answered that in the waterproof question, but just say somebody doesn't get it wet. Why does it smell after a period of time?
I think it's why we take baths and showers. So you sweat, your skin has bacteria on it, And if you want to make bread, you put yeast in a warm, moist environment. And so you take bacteria, put them in a warm, moist environment. You're kind of making bread.
You're making bread in your cast.
Something like that. So it's just, and you can clean as far as you can get inside that. And a lot of times I'll recommend just using some alcohol because it evaporates quickly. Water, again, it gets wet, then the padding gets wet. Alcohol will sometimes be different than that. But cast smelling, for the most part, I mean, it's not great, but it's just part of being in a cast. Now, there are times where you get a pressure sore in the cast and then it smells really bad. That's a difference. But it's just a matter of usually just having sweat and skin bacteria and being in a warm environment.
That's what I tell our customers as well. Just to be prepared, because that does happen. And I said, even if you're not sweating, our bodies perspire, and if it doesn't have a chance really to dry out, and that inner cotton padding will help. It will prevent it from drying out properly, and that's where the itch and the smell comes from. Yeah. So and again, my daughter's broken 22 bones, so we've seen and smelled a lot, and it's been one of the other comments is we get quite a bit of comments of, the doctor put on a splint cast and then I've got to go back in 10 days later for a cast, and why do I have to do that?
Certain fractures will swell a lot, and you need to accommodate that. It's one of the reasons we tell folks from the ER, don't make an appointment right away, because you'll just come in and have to get splinted, and then we have to bring you back in a week, 10 days, and change it. Now, that's not true for all fractures, but when we put a splint on, for the most part, we're expecting it to swell. And you can make a splint very strong. A splint can be just about as strong as a cast. You have to pay particular attention to certain aspects of it. But if you put a hard circular cast on something that's going to swell, the pressure that's created can be really, really severe. So that's why we'll put a splint on.
And so why do some people feel the pressure? You brought up another question. So like if you put like a tight coat or something, or a pair of socks over it or something like that, why do some people, not often, but I do hear this occasionally, they feel the pressure around it and it hurts them?
Yeah, that's a real balancing act. When you're casting a fracture, there's an old saying, it takes a crooked cast to make a straight bone. So if you have a fracture and the fracture wants to angle this way, you actually make the cast with a little bit of a bend this way. Avoid that. So we would look at casts when we're training people, and if the cast is perfectly straight, first of all, it's a tube that has a greater chance of slipping off. But also you have to consider which way is the fracture likely to drift, and your cast should counteract that some. And that balance of how much pressure to put on there and that tightness is really a skill to have. And so if you're having pressure, that's the time to really super elevate it. Just whatever it takes to keep it up with pillows, because a little bit of reduction in swelling can make a big difference in how you feel. And if you keep it down, and this, if you sprain your ankle or hurt your foot, you put it down in the morning, that first morning it's like, wow, what happened? And it's just because the blood's rushing down there. So some pressure inside is not always bad, but you need to be cautious that it doesn't keep getting worse.
Great. Just looking at some comments that we have. Oh, why are so many boots prescribed now?
There are a lot of things where cast is more than you need. Now, the problem with removable things is that they're removed. But again, here's my bias of being a pediatric orthopedist, because whatever a kid can do, they're going to do. So let's say you have a broken bone in your foot and you need to have a firm base to step on, but you don't need to be in a cast 24 hours. You can take it off for sleeping. So what do you do for that? And that's where a boot can be good. It's also good for sprains and soft tissue injuries. So my wife broke her foot a couple of weeks ago while she was running and tripped. So got an x-ray and then put her in a boot. But the boot can be really effective, but you also have to pay attention. If you're supposed to wear it all the time when you're standing up, comply with that. It's not a matter of just how much I can deviate from that, because you don't win any points by coming out sooner. So the short answer is just because it may be just as effective, and you can take it off for sleeping and showers.
Got it. And when my daughter was younger and she broke her humerus, I was so excited. She was only 10, but I was so excited because they put her in a splint cast. And of course, we'd had 5 other broken bones before this. So I was excited because I could bathe her. I could just take off the wrap and the splint and bathe her and wrap it back. She wouldn't let me near it because she was afraid. She was, frustrated, the whole thing. And then, so when I finally did get her a bath and then finally got her out and then finally put it back on, I said, okay, splint casts are good for adults, not necessarily for children.
Yeah.
Or just never take it off. I mean,
Yeah.
because you can't explain that to a child as well.
If they object to moving it or lifting it or taking it off, it tells you something. It tells you the fracture is still unstable.
Yeah.
And, the body's internal mechanism of don't move that, usually it's telling you something. So, and then as you start feeling better, healing a little bit, then you can take it off.
That's good advice. So, talking about children and sports injuries, somebody breaks a bone there in football, and there are certain leagues that allow you to come back if they're padded. And the cast protector is just an off-market product, but it's big foam tube. How do you feel about that? And or what stage? I suppose it depends on the type of break, that type of thing.
Yeah, that certainly depends on the type of break. But I always have a bit of a dilemma, just in real honesty, that we want them to get back in the game, but in many cases, it's not the best thing to do for the fracture. And then you go from what's the best thing to do for the fracture to what's maybe not the best thing, but not so bad. And then it's like, okay, so what can I do that's maybe a little bit bad, but still lets them play, but won't change, all the way up to the point of, can I let them play with something that, and I've done this for kids, especially seniors in high school, final game, they want to play. It's like, okay, your fracture might move. And so that's a real balancing act. And it's really a matter of understanding the risks. And, we can fix most anything if it moves, but you may take something from a cast situation to an operative situation. And, that's certainly not always the case, but you just have to understand that the more activity you do, you take on more risk.
I understand that. I also understand that a lot of times that the protector for the cast isn't for the patient or the player, it's for the other player, so they don't get hurt by this orthopedic device, whether it's a brace or a cast or yeah. Yes, exactly. Okay. Okay. And why does it seem, that's one of the questions, why does it seem that there are more broken bones the last few years? Is that just because I'm aware of it now?
Well, sarcastically, I always say, thank goodness there's still broken bones, because I had kids to put through college. But, the numbers show that the fractures really are staying about the same. They may change in age, but it's, one of my old professors used to say, it's a sign of a healthy kid. People being out there and being active, and I had a good buddy of mine. He had 2 kids. One daughter broke her bone a couple of times. The other son never broke, and he would jump out of trees. He would land on the car when Dad would come home. Never broke anything. It's just bad luck. And so doesn't always mean something's wrong, as opposed to you're doing a lot of activity and things happen.
Well, so in your experience, and this is what I learned after 11 years being in this business, and my daughter too, that there's almost like little pods of breaks. In other words, sometimes families will get more breaks than the next family, or there's a neighborhood cul-de-sac that seems to get more breaks than other. Have you seen any anecdotal information like that?
We see it in kids. Kids will go through a phase where they break and then they'll break again. And I knew one kid that broke pretty much every year, and his mom would just come in and say, "Don't tell me, just."
Been there, done that. Yeah.
He took the brakes off his bike and then went down the hill and couldn't brake. And he said, partway down the hill, I thought it's probably not a good idea. And so turned into a wonderful guy. He's got a great career. It's kids are wonderful, and they're just always finding a new way to do something.
Yes, they do. And so you explained why sometimes people get a long arm cast. I consider anything above a joint, like if they had a Colles fracture, which is like a wrist fracture, and they get a long arm, or if they have a tibia or a fibia with 2 bones down lower, that they would have a longer cast primarily for the immobilization, and any other factors why?
The rule of thumb is that you want to immobilize the joint above and the joint below. And so think about if you break your arm here. So if you break your forearm here and you put a cast that goes to here, you've only got that much hold on the cast. So my elbow is bent here. So if I break it here, I don't have a whole lot of hold on that. And so if you're really going to hold something, for the most part, it's got to be inconvenient. And so a joint above and a joint below, which also leads to why some fractures are operated upon, because you can avoid immobilization, you can move better. There's some advantages. But especially in kids, you can get most things done with a cast and do it well.
So I think it's a good time for me to share a couple of the stories that I had for CastCoverz. And there was a mother called, and this is years ago, and I swear when I picked up the phone, I could hear the displeasure coming through the lines before she even said a word. And she was a mother, and she needed some cast cover products for her son, who was 19. And I could just tell there was an edge in her voice, and she was really trying to maintain kindness. Because I said, so what did your son break? What does he need? He broke both his arms, and he was casted above the elbow on both of them. Well, as a mother whose daughter has broken bones and how much she needs help and care, especially if you have a long arm, I will just say this, that I said, oh my gosh, I certainly hope there's a man in the house, and other than your son. And she just said, no, there isn't. I burst out laughing and said, oh my gosh, you two are going to need therapy. She absolutely cracked up, and she said that was the best laugh she'd had in a week. And so I did make her feel better. I wish I'd kept in touch with her, because you can only imagine how hard it is. I'll just say this, how hard it would be to brush your teeth, to clean, to shower, to take care of other personal hygiene needs. And she wasn't happy with how her son, he jumped off the roof. That's all I just.
Yeah.
And I know you've heard so many, many stories as well.
Yeah. When we've encountered kids who need both upper extremities casted, we've actually gone to the point of saying, we will operate on one if you wish, so you have one free hand to take care of your personal hygiene. Kids will eat like this. They'll eat like a baby bird, and they'll be happy with that, and doesn't care about brushing their teeth or keeping clean. But you go to the bathroom, two arms like this, not a good thing.
No, it's not. We got a comment from Brad, who said, I always thought it would be, and he's on YouTube, I always thought it would be awesome to have a cast, because I've signed many of my friends' casts. Worried about how bad the pain is, though.
Yeah, having a cast is really cool for about a week, and then it really wears off quickly.
Yeah. Yes. And as I've said, and I will say this to my last day, my last breath, as the mother of a daughter who's broken at 22 bones that we know of, no, it isn't fun. I mean, it's novel maybe for a day or two with other people, but the pain you're in at that time, it's not worth it. So another question is, how do you prevent breaks? Great question.
So there's really three factors that go into it, and you can only affect one. So one factor is just the genetic makeup. Some people have harder bones than others. Some races have harder bones than others. And you can affect your genetics. The next factor, which you can affect, is just diet. You want to make sure you've got enough calcium and vitamin D. For instance, people who are indoors a lot, especially in colder climates, they always get a little bit of vitamin D deficiency in the wintertime because they go inside, and then it improves in the summertime. So you can ask your doctor about taking a little bit of vitamin D supplement in the wintertime. And vitamin D actually is really, really good and can even help fractures heal faster if you've got a little bit of deficiency. And you can't make it go too fast, but we'll often recommend for people just to take some additional vitamin D while they're healing. And then the last is just the activity that you do, participating in sports, riding a bike, but you don't know when it's going to happen. It's just gravity. I mean, you walk downstairs and you fall and you trip, and you don't plan on doing those things. But
That's the nature of accident.
the best you can do is just optimize your nutrition. Make sure you get enough calcium, vitamin D in your diet.
Okay, great. Thank you. And I also read a research report. I haven't read anything recently that there are 64 million orthopedic events in the United States alone, but that also includes, like hip or knee replacement or something like that. But then for children, there are 7 million fractures for children. Do you have any other statistics that are different?
No,
just a lot.
Yeah, and a lot of them are they're simple things that can be treated, managed well, and that's another thing just to remember. It'll pass. It all passes.
Yep.
Then you look back on it and say, remember that cast you had? You won't look back on it and say that was great, but you get through it.
So we have a new question, and this is from Jennifer, and she broke all 3 ankle bones, and she's been released to do all things again, and she's training for roller derby. What is the best way to stay safe?
Well, should I not give the obvious answer of don't train for roller derby?
By the way, she says happened on Father's Day 2020.
That Father's Day present. So you're released to do all things. So the first thing you want to do is get motion back, and physical therapy is really helpful for that. And it may not be magic, but I just found for myself and some of my patients, having a therapist coach you along, this is what you should be doing week 1 and week 2, week 3, as opposed to you're falling behind, you're not keeping up with your range. Once your range of motion is improved, you want to work on strength. Last thing that happens when you're in a cast or injured is you lose what's called proprioception, the position sense. So let's say you're standing on your foot and your ankle tips. Well, your body knows, whoops, it's tipped. Let's pull back this way. That very fine sense of joint position is an entirely separate nerve pathway in the spinal cord. It's really very, very important. That is damaged when you have an injury. And so that balance needs to be restored. I know there was something in the question also about bracing. Inside a skate, we haven't found any brace that's really comfortable because the skates have to be pretty tight. But if you can learn taping or have someone tape your ankle, taping can do an amazingly good job. Taping actually for the first 30, 40 minutes is even better than a brace. But if someone can tape you, you can get that inside skate that's laced up, and then that'll be good. But still, range of motion, strength, and joint position, proprioception it's called.
Proprioception. And then Jennifer continued, I've been walking since August, also cleaning pools, carrying 100-pound vacuum. My balance is great.
That's terrific. That's great. See, getting back to activities like that is a terrific and a normal way of getting range and strength and proprioception. So it sounds like you've been doing well, and then it's a matter of getting back in there, but having some kind of assistance like tape on there would not be a bad idea to start.
Great. Okay. Another CastCoverz story. We had a customer call, and a wife called, and she said, my husband and I want to go to the beach, and he wants to go swimming, and he's in a boot. And I said, well, don't. And I said, you just don't have the mobility, and there's no product on the market to keep the boot dry. And plus it can't stretch over the boot and then seal around. There's no memory value that has that elasticity. So then she said, could you talk to my husband? And she whispered it. And I said, of course. So he gets on the phone, and there's some people that I can talk to fairly transparently. And I could tell right away, he just needs some tough love. And I told him that, can you imagine if you got wet, if you got your boot wet, you'd sink like a rock to the bottom of the lake. It was the ocean, I think. And he said, all right. So he didn't. How many people do you have who, and we get so many people, but I want to go to Disney. I want to do this. And I have to tell them, sometimes you can't, only because my own daughter, we had to say no to her so many times as well. There are some things you just can't do because you're injured and your body is already focused on that injury. And so you have to be careful. To talk about that a little bit about healing. And I know you talked about what you can do, but why is the body expending so much energy in healing?
Well, it you'll sometimes need, for certain injuries, you'll need to almost double your calorie count. It takes a lot of energy to heal. Your body is it's creating a lot of inflammation and then calling up a lot of reserve cells and then calcium. And all this is mediated by different elements, proteins, vitamin D, as we said. We do try pretty hard to find a way. We've had people have, we've been planning for this trip for a year. And if you're willing to accommodate certain things, like, okay, you can do that, you got to be in a wheelchair. You can do that, you have to be more cautious about it. Again, for kids, Disneyland, trips to Hawaii, you can go to Hawaii, but you can't go in the water. We try to work pretty hard with that, because even though the fracture injury may heal inside its cast if it's protected, there's a certain amount of motion that if you wanted to create a non-union, a fracture doesn't heal, what you do is you move it too much. Any bit of motion is okay. But if you wanted to create a non-union, wiggle it. And so it doesn't help it any. And so you just have to respect that. And once it starts to heal itself enough, then it can take a little more motion. But especially in the early to the mid phase of fracture healing, you just have to respect the fact that that injury needs to heal, and stability, whether it's operated on stability or cast stability, in this case cast, you're not going to get any extra points. You'll slow things down, and you just certainly won't help it any.
Yeah, I think the respect the injury is the key. And that's the message that we always try to give as well, is that you've been injured, you're compromised, your body's compromised, your body's taking the energy to heal. And, particularly with a leg, and if you're off a little bit and you try to be too active too soon, you could cause other injuries as well, and, or exacerbate the injury that you have. So just, respect the healing process. This too shall pass. It'll be a great Christmas story Christmas card is what I say. And then let's see. Jennifer said she's the one with the roller derby. The ROM isn't the best.
Range of motion.
Yeah. Yeah. Our ROM is range of motion, for those of you who didn't hear.
Physical therapy. Yeah. Hopefully it's not too far out to do Father's Day, walking on it since August. Yeah.
Yeah. Absolutely. So have you seen an increase of osteopenia in young people?
There are some people's osteopenia, loss of bone content. If I take a net and just put you in a cast, you're going to start losing calcium. The motion, even though if I cast you here, your fingers can still move, wrist can't, fingers can still move, the bone is seeing less stress, and bone responds to pressure. If you're not walking on something, you're not getting enough muscle movement around there, the body will take some calcium out of it, because it doesn't want to waste calcium. It says, oh, we don't need that anymore. You're not walking on that. You're not using that. So we'll use the calcium elsewhere. And so happens a lot more in adults, but we'll see some kids where you put them in a cast and then the body reabsorbs so much calcium. You also have to deal with the fact that when you take the cast off, now the whole bone may be weak because it's osteopenic, meaning calcium has been taken out of the bone. And so we'll see that sometimes early on an x-ray, and then again say more calcium, more vitamin D. You just want to prevent that. There's always a race between the downside of immobilization and the upside for fracture healing.
And I see what you mean about the balance too. Absolutely. Yeah. Okay. Another question is, my dad was in a sling, and he had to have a block. And he had shoulder surgery. Why did he have to have the block? And the block, what the person is referring to is, if there's an arm in a sling, there's usually a block, so it braces the arm in a certain position.
Yeah. So if that's the block, thanks. I thought they were talking about a nerve block for the surgery.
Oh, yeah.
So that usually means you've had rotator cuff surgery. So the rotator cuff goes around to the top of the humerus. So your deltoid is the muscle you feel that lifts your arm up. But inside are 4 muscles that form the rotator cuff, and they have to hold the shoulder head, the humeral head, so the deltoid muscle can work. And when you tear part of the rotator cuff, it retracts and pulls back. I'm trying to do this here. It retracts and pulls back. So when you suture it, you have to pull it to attach it back. And that's a lot of tension. And so one way you can reduce the tension is lift the arm up, and you're bringing the bone to the tendon of the rotator cuff. Then when it's healed, you got to get the arm down. But that's usually gravity helps that, but usually the block or lifting is to just help the ends come together, take tension off of the repair.
That makes good sense. Okay, so we're just about ready to wrap up. Okay, playgrounds. One question is about playgrounds, and they seem to be a source of broken bones. Any thoughts on that as an orthopedic surgeon?
Monkey bars. Oh God, monkey bars. So as we talk, kids will break bones, people break bones, happens all the time. Bikes, running, sports, just being a kid. The one thing that I couldn't watch my kids do was go on monkey bars. Just there's a disproportionate number. So September and May, remember when we used to go to school, September and May because I couldn't figure it out, maybe the weather got warmer, but September kids go back to school and they find the monkey bars and they are breaking their elbows and wrists right and left. So I've been asking 6 and 7-year-olds for 30 years, how do you break? It's like, well, I fell. And I get that, but how did you break? I say, well, I tried to skip a bar. Well, my kids would be on monkey bars. Like, I wasn't going to say don't go on them, but I turned away. I couldn't. It terrified me.
It's like me watching somebody move a piano. I just can't do it. I just can't.
So I'm not sure. Monkey bars we see a lot of injuries from monkey bars, and I don't know if there's anything you can do about that. The surface, they say if it's concrete versus padded surface, we see breaks on all those. So the other thing I wanted to mention is trampolines. Oh,
yes.
So trampolines got really popular over the last sort of 7, 8, 10 years. And although I would say, this is just my experience, we don't see more injuries from trampolines, but the ones we see are worse.
Yes.
It's almost as if it's double the energy. Picture you come down, you're twisted, you break, but the trampoline comes back up. Spine injuries on the trampoline, you may not see anything on the x-ray, but at that moment of impact, the spine will bend. So trampolines are really scary, and that's one of the things we recommended against. I know it's tough because kids love them and they're a lot of fun, but we're just really cautious with trampolines because of the injuries they can cause.
And I just want to add that some friends of ours, child was on a trampoline and sadly broke his neck. And yeah, I mean, that's obviously the extreme, but it does and as a result, I never allowed my kids on a trampoline. I'm sure they did sometime and I'm not aware of it, but not on my watch and not as far as I know. But and then anecdotally or maybe scientifically, some research that I've heard that if a child or a person falls greater than their height, the likelihood of a break is higher. So if you're 3 feet tall and you fall 4 feet, that's a higher risk of breaking a bone. Have you?
I don't know that. That's an interesting.
It's a wives' tale maybe or something like that. But I got to tell you, whenever Ellie, our daughter, was over 3 feet, when she was 3 feet, she broke a bone, or if she was over 2 feet or something like that. A lot of times playing with her big brother too. But
there you go. Big brothers are a risk. Yeah. I always say that those be hard studies because you'd have to drop kids from successively.
Yes.
Up for that. But fortunately, the vast majority of breaks, the overwhelming majority, heal well, get back to activity. It's definitely an inconvenience. And if you're smart about it, you heal and you get back to it. So can you close with telling us the difference between a green stick fracture, a compound fracture, all the different kinds of fractures? To me, a fracture is a broken bone. Yes, that's the one thing that I've been corrected by parents, even though this is true. A fracture and a break are the same thing. I don't know where it came about that they were different, but they're not. Yeah. We just say fracture. So then we'll start with the first, which is a fracture kids get called a torus fracture, usually in the wrist and the bone. Torus means ridge. I'm going to hold this over here. And so the bone at the end has a lot of water content and it'll just wrinkle. It'll just wrinkle on itself. It's a very stable break. You're basically casting it or splinting it just so that they don't do it again. So that's the torus fracture or ridge, tiny little wrinkle. The next green stick fracture where it breaks on one side but doesn't break all the way through the other. And it's exactly like a green piece of wood. So you crack one side and then the other side bends. They're a bit problematic, first of all, because the bone wants to stay like that and you have to push it straight, which takes the cast I was talking about.
Yeah.
And they tend to have the highest refracture rate for some reason. Then the next is a fracture, complete break. Then you get a fracture with multiple pieces, which is a comminuted fracture. You can have a break with a bunch of different pieces around there. Those actually heal quite well because there's a lot of surface area of the bone.
Mm-hmm.
And an open or compound fracture is where the bone pokes through the skin. So
all those different kind of fractures. And then you got sprains, and we can talk about that in another call. I mean, there's just a plethora of issues that can come up when it comes to musculoskeletal issues. So anything else that you wanted to add?
No, just I think the best thing is having a good relationship with your orthopedic surgeon, someone, the staff, the nurse in the office. We've had, like I said, frequent flyers. People come back and they get to know the office staff, and just having that relationship so you can ask questions and feel really comfortable that they're going to try to keep you and keep your kid and your family as active as you can be while still respecting the injury that you have.
Yeah. And I often say most broken bones, I would say the significant majority, and please correct me if I'm wrong, is just because we're human and things happen, and it's okay. And it'll make a great story someday.
Yep, absolutely.
Yeah. Even if it's right before you leave for Disney, or there was one girl who on her first day of summer was horseback riding, fell and broke both her arms. And she was younger. She's probably 20 now. She was probably 11 at the time. Just adorable. And she got the brightest CastCoverz, but it was the first day of summer.
Those things are awful when it happens. Yep.
Yeah. And it does happen. It's just a story. That's the way I look at it. It's just a story. It'll make a great Christmas card, or, it's a wonderful aspect of being human, but that's the word accident. You can't plan it. Exactly. It's not in your calendar. You can't, that's what accidents are. Great. Okay. Well, I think we're done. And I want to thank you very much, Dr. Hoffinger, for coming on. We hope to do this again soon. We'll let everybody know when we do, and maybe one time before Christmas. And then we'll get back to you on the new year, 2021, which we're all looking forward to. And thank you very much. And anything else?
Nope. Thanks very much.
Great. Thank you for coming on, and we'll see you later. Thank you.
Bye, buddy.
Okay. Bye.